we name it. We say, I just feel really mad right now, or I just feel really down right now. And then we can move from there to, okay, what are my values and what do I want to commit myself to do? So we stop the struggle with the anxiety, and we'll call it, I don't have if I had a rope, to struggle with someone. But maybe, who wants to play tug of war with me? Okay. Let's say here's stress, okay? This is a hole. So don't walk into the hole. And she's anxiety or depression or stress, whatever. Okay, and you're going to try to pull me in. So, you're too strong. Yeah, she's very strong. Okay. So let me be strong. Okay. So I try to pull. I am not going to be stronger than her. I cannot pull her into the hole, but she's trying to pull me. Okay, so keep trying to pull. And then I'm using all my energy. Okay. But over there is my son playing volleyball, and I'm like, I'm still fighting anxiety, so I can't come watch you. I'm so sorry. Okay. And then over there is my husband wanting to go on a date. I'm like, no, I'm so sorry. I'm fighting anxiety. I cannot. Okay. So what can I do? Can I get stronger and pull? No, she's too strong for me. Okay. What can I do? Let go? Let go, okay. So I can let go. You're still there. I haven't pulled her into the hole. But I can say, I see you, but I'm going to go spend time with my son and my husband, okay? And then maybe I'll come back and I'll look at you and then make you like, God, I don't know what to do with this here. But I don't have, and you're going to try to get me to hold your hand again. Okay, and I might, and then I can let go again. So I'm accepting that this is part of how I'm feeling, but I have an option to realize, okay, this is here, but today I can go and do that. Today, I know you're here, but I can go do that. Does that make sense? Yeah. So we have a choice. It's kind of like finding that bottle void.
Thank you.
Awesome, wow, that was way yeah. Well, she told me before, and then that's how she came up. Awesome, that was good job, but I know the other ones are going to say amazing things as well. So this section, just, you guys, so you know, it's about women's health. That's the focus, and we have all the nurses here and the physiotherapists. So we have specialists here. Personally, right now, we just came in between to just help support, right? With our stress and our social health. But there's going to be an opportunity for you guys to ask questions, and we want you guys to ask questions concerning your health. The nurses are here, they can help as much as they can, all right? As much as God brings them grace. So I just want to talk in a minute about social health. All right. We all know that relationships are the building blocks of life. We need relationship. No man is an island. You cannot fulfill destiny alone. You cannot fulfill purpose alone. We need one another. We need each other. You need people. And research has shown that people that have strong social ties actually they live happy lives. They are very happy, and their overall physical well-being is good. That's the power of relationship. But then when we talk about a relationship, there is a right relationship and there's a wrong relationship. Amos 3:3 says, come to work together except you agree. If somebody does not want to work with you, you cannot have a relationship with that person. You cannot force yourself on that person, because the more you keep on forcing yourself to have a relationship with that person, and that person does not want you, you're going to feel rejected. And that's not good for your emotional, for your health. She's talking about emotional health, for your health. Alright, they're all muted, right? It's not good for your health. So you need the right person. So if you sense that the person does not want you, my dear, like she walked away, just walk away. You need the right person. Can two walk together except they agree? Now, unless you can say bad company that corrupts good manners. You need the right company. If if you're involved in a negative environment, it's going to affect your physical health. All this health issue, mental health, physical health, social health, all this health, they are all interconnected. If you don't take care of one, it affects the other. The most important relationship that you can have is your relationship with God. Faith is the foundation for our overall physical well-being. And I'm just going to leave you with 4 things. We've talked about it all day. If you were here early when I ministered, I think I hammered on it, and I'm just going to reiterate it again. The 4 things are pray daily. Pray like all pets are prayer. We said for you to bloom. You bloom where? For those of you that are here, where do you bloom? On your knees. Prayer is the key thing for you to bloom as a woman in your health. Alright, the next thing is meditating on the scripture, the power of the word of God. And then let go of your worry, let go of your fears. Alright, that leads to anxiety. And anxiety, I know if you go to all the specialists and you tell them that you're suffering from anxiety, they give you a prescription. They don't work. Those prescriptions do not work. Because anxiety is just a factor of worry. You're worried about something. You're afraid of something happening to you. So you're anxious. But the secret to actually blooming in our health is the word of God. And I want to take us to Philippians 4:6 that says, do not be anxious about anything, but in everything, by prayer and supplication, with thanksgiving, make your request known unto God, and the peace of God that passes all understanding will fill your heart. Once you have God's peace in your heart, you're not going to worry about anything. And oftentimes, some of these sicknesses are as a result of the fact that we're worried, we're anxious, we're depressed. And all the specialists are going to talk about it, so I'm not going to go deep into it. But the last thing I want to mention is forgiveness. So powerful. When you forgive somebody, it's not about you. It's not about the person, it's about you. You're actually helping yourself. That's why there's something called forgiveness therapy. People that have suffered cancer, some of them have actually been healed when they forgive the people that hurt them. Forgiveness is a powerful thing. When you forgive, you're setting yourself free, not renunciating the other person. So these 4 things, if you can put into place, if you bloom in your spiritual health, which is the foundational for us blooming in our overall health. And I'll pass it over to our mental health specialist.
Okay, so since we are talking about all health issues pertaining to everyone, I'm going to talk a little bit about mental health and psychiatry. Mental illness is a disorder that affects people's mind, it affects their behavior, it affects their feeling, it affects literally everything about them. It comes with a lot of distress, making life difficult, unable to fulfill your dream, unable to have a good relationship, unable to even groom yourself, makes you poor and homeless if not taken care of. Mental illness does not have respect for anyone. It can happen to a child, it can happen to an adult, it can happen to people when they are old, it can happen anytime. Does not have respect for your race, for gender, for your background, for anything. It is said that many people have mental health issues, literally everyone. But it's when the symptoms persist and it's not taken care of, then it becomes mental illness. Otherwise, once in a while, everyone has mental health problems. There are different kinds of mental illness, many of them, ranging from depression, anxiety, schizophrenia, bipolar, eating disorder, you'll be surprised, and many of them. And especially mental illness, it doesn't have a specific way you can say, this is what she has, this is what he has. It can only be diagnosed by a collection of behaviors that the person exhibits. And what are the risk factors? Family history, could be trauma, could be early childhood neglect, it could be trauma, it could be accident, bad relationship, stress, untreated stress. So the key to it is early detection. When you feel those things that you know that are out of norm, don't keep it, don't delay. Take yourself to your doctor. Your doctor is the best person to assess you and know if she needs to refer you to a specialist. How do we take care of ourselves? Like Pastor Blessing says it, keeping away from things that stress us up. And there comes especially relationship. If a relationship is giving you stress, cut off from it. It's better to be alone than to have stress with a relationship. And most relationships are spousal. If you marry the wrong person, they're going to be beating you every day and speaking evil words over you every day. And that can lead to mental problem. You have to confide to somebody that you can trust, a family member that you can trust, that will be able to protect you in case you are not able to think for yourself. To your spiritual leader, if you have one that you trust that can lift you up in prayer, or to a trusted friend. Just like we have gestational in those diabetes, also in mental illness comes also along with pregnancy, which is called prenatal mental illness. And most of the time it's as a result of stress. Those things that worry you, especially for new mothers who have never gone through pregnancy before. Thinking about how you're going to cope, thinking about so many things, thinking about financial problems. And again, for those of us who move over to this part of the world where you don't have your parents and all those people you trust that can be helpful to you, you find yourself lonely. And that pregnancy that's supposed to give you joy becomes a thing of, you know, you're crying all the time because there's nobody around you. Sometimes you have that tendency of giving up that child, and that's why many people give up their children. Some ladies feel like, you know, dropping their children, even if they don't have it, the true intention to do it. But it's something that goes in the mind. So to just wrap it up, when we have such things, or you have a friend who you know that the character, the behavior is off, help them. Take them to the doctor if you can. And one important thing, if you don't mind, is it's better to take yourself to the doctor than somebody else or the police getting you to the doctor. Because when the police takes you now, you become not voluntary but involuntary. And you cannot be free anymore. You are under monitor. I hope with this little exposure, I'm able to make a contribution to
Good afternoon, everyone. My name is Teresa Iwerim. I'm a registered physiotherapist, and I've worked in a hospital setting, and presently I work in private clinics, one in Surrey and one in Port People. And I'm here to talk about physical health. And talking about physical health is pretty broad because you will notice that it ties into a lot of what other people have already spoken about. So I decided to narrow it down to benefits of exercise. And to also narrow it down, because it's also really broad, someone said try AI, so I put a prompt on ChatGPT. I said put together a presentation for women on benefits of exercise, and then ChatGPT brings out this stuff and titles it Empowering Women with Exercise. And I'm like, oh wow, that's interesting. I didn't tell ChatGPT what conference I'm going for. But exercise is actually empowering yourself. And I know many of us already know about the benefits of exercise. I'll just run through a few of the benefits just as a reminder. And I know Sister Will talked about the situations with perimenopause, menopause symptoms and all that. Exercise has been shown to increase the hormones that normally are declined as we age. So it gives you that boost without you getting on hormonal therapy. Okay? Exercise also lowers the risk of heart disease, stroke, cardiovascular diseases, some types of cancer, and it also helps with a healthy gestation. So you're pregnant, it helps you to have smooth pregnancy, safe delivery. It lowers the risk of having to have a cesarean section, And exercise helps with improving your sleep. Exercise also helps with stress management. It also lowers the hormones that mediate stress, cortisol, and increases your feel-good hormones, okay? So it also helps with cognition and memory, attention processing speed. It helps with limiting weight gain, reducing obesity and other related health conditions. It improves bone health and balance, therefore reducing your risk of falls and injuries. Even as winter is coming, you find that many people sleep on the ice, and you notice that people who get injured more are people who are not fit. And I'll explain that later if we have time. And also helps with symptoms of anxiety and depression, and it gives you an overall better quality of life. And I was so let's jump into exercise prescription. I'll take your questions in case I missed anything. I guess I'll have time to do that. So the World Health Organization recommends that every adult between the ages of 18 and 64 should have an average of 150 to 300 minutes of exercise per week. So that's an average of an hour per day, as long as you're healthy. However, the CDC and the Canadian Heart and Stroke Foundation have a consensus of at least minimum of 150 minutes of exercise. So that comes to 30 minutes of exercise 5 times a week. And it's actually 150 minutes of moderate intensity exercise. So what's moderate intensity exercise? So that would be brisk walking, dancing, gardening, tennis, slow biking. And with moderate intensity exercise, you should be able to talk, but you shouldn't be able to sing. So that's how you rate what you're doing. Am I doing a moderate intensity exercise or a vigorous exercise? So that would be your test. Try singing. If you're able to sing, you need to kick it up a little bit, okay? Or, so if you're not doing 150 minutes minimum of exercise, you should be doing 75 minimum minutes of vigorous or intensive exercise, which would be like hiking uphill, running, swimming laps, vigorous aerobic dancing, heavy yard work such as continuous digging, playing tennis singles. The first one for moderate was playing doubles, and cycling faster than 10 miles per hour, and skipping, jumping rope. Okay? So one thing for me is I notice with moderate intensity there's dancing, with vigorous there's dancing, so dancing is my favorite exercise. Okay? And there's ample opportunities to dance if you look for it. And we also recommend strength training at least twice a week. So lifting weights. That's because as women get older and you get into perimenopause and menopause, you notice that you start to lose muscle mass. The risk to that is that when your muscles are weak, they pile up fat. So it becomes harder to lose weight. So but strengthening the muscles also helps with your bones and ligaments and all that and tendons. In addition to the strength training, it's also recommended to have flexibility training so that your flexible stretches. And that's because, just imagine two sticks, one is green, one is brown, same forces apply. The green stick will bend and come back. The brown one will break. So two people sleep on the ice, one breaks a bone, one doesn't. Why? Because one is more flexible than the other. And I just want to quickly bust some myths, just to tell us, because I noticed that, I know talking to women, I'm like, so what do I need to help us exercise more? We all know we should exercise, right? But you notice that when you're talking to people about exercise and they are slim, they feel, oh no, she's not talking to me. She's talking to those fat people. Exercise is for everybody. It's not about your body size, body weight, or shape, technically. It's about fitness. It's about something happens here. Can you run to Gateway Station without passing out? You know? A lot of times, like Blessing said, we had jump. If there was an earthquake and there's a ditch, some people can't jump over it to get home. They'll be here waiting for the fire trucks to come and put a ladder or something for them to cross. So it's about fitness. So it's about everybody, regardless of your body shape, body type, body weight. Okay? And then another thing we women say is, I'm active every day. I'm always busy. I'm on my feet all day. That's good. It's better than being a couch potato. But for exercise to be beneficial, you need to have 30 minutes of continuous exercise. You need to get your heart rate up and sustain that for at least 30 minutes to get the aerobic benefits of circulation, strengthening your heart, strengthening your lungs, you know. And for those, in case you want to ask, for those who are working on weight loss, you need to sustain that for at least 45 minutes. Any exercise less than 45 minutes doesn't burn body fat. Okay? So, bringing out time for exercise is super important. We know you're busy. Everybody is busy. But this body carries you around every day. This body works hard to make money for you, to dress well and look good. That 30 minutes is a time to tell the body, I see you. I appreciate you. I understand what you're doing for me, and this is just my time to take care of you. Thank you.
Hi everybody, my name is Rochelle. I'm a registered psychiatric nurse, and I was asked to talk a little bit about mental health, but more so in the context of substance abuse and substance use. So I'm going to piggyback a little bit off of Anne. So before I go into it, it might be a little bit triggering for some people. So I hope I kept it kind of light, but hopefully it will be okay. Feel free to excuse yourself, or if something comes up that triggers you. So I wanted to talk about substance use because it's happening all around us here in Surrey, especially right outside our church. There's actually a safe consumption site across the street. Some of you may or may not know that. So it's happening every day, and even if it doesn't affect us personally here in the church, I think it helps to know so that we can build some compassion, some empathy, and maybe some practical examples of how we can help people. So in BC right now, there's a huge toxic drug supply, especially with a drug called fentanyl. BC is actually at the epicenter of Canada's opioid crisis. Some of the most common drugs that are used around here are like heroin, ecstasy, crystal meth, cocaine. And according to the coroner's office last year, 2,500 people died from drug overdoses. That's the highest ever recorded here in BC. So why do people use drugs? Fentanyl. Fentanyl is a synthetic opioid. It's 50 to 100 times stronger than morphine. The reason people use it, short-term pain relief, euphoria, feeling relaxed, but it comes with a lot of risk, such as losing consciousness, even death, respiratory depression, right? So I know a lot of the times you might see people, the ambulance just over here is because someone might have had an overdose, usually from opioids. Another problem is that, unfortunately, other drugs are now being mixed in with fentanyl, and so that's causing a lot more deaths than previous. So another drug is crystal meth. It's a stimulant, and people use it because they want to have intense energy, they want to feel alert, they want to feel motivated, and they want to feel happy. It gives that feeling. But it has also risks, such as anxiety, feeling paranoid, becoming aggressive, and even long-term brain damage. There's also cocaine or crack, very commonly used here in Missouri as well. It's also a stimulant, and it can be smoked, snorted, injected. It gives people feelings of happiness, confidence, and pleasure, so that's why they use it. But it also has negative side effects: irregular heartbeat, stroke, heart attack, and obviously addiction. Now they're actually cutting cocaine with fentanyl, which makes it extremely deadly because it's acting on the opposite sides of your central nervous system. So that's very dangerous. One is bringing it up and one is taking it down at the same time. Very, very toxic for your body and your brain. Finally, I'll say a little bit about ecstasy. It's another stimulant, but it also is a hallucinogen, which means that it makes people hallucinate, see visions, hear things other people aren't hearing. It might make you feel like someone is touching you when you're not being touched, things like that. So it makes people feel very warm and fuzzy, right? So they like to use it for that. And it's common at like parties and raves. So I bring that up in the context mostly of like our teenagers and our, young adults going to parties. So it would be good, it's good knowledge for them to have because these things get passed around and given out at parties. So the risks are dehydration, heat stroke, depression, confusion. Just yesterday I spoke with someone who went to a friend's house and started using some substances and ended up at the hospital. And when she spoke to me, she said, I don't know what happened. I don't remember what I did. I don't remember the friend I was with. I don't remember how I got to the hospital. So it's very, very, very dangerous. It can be very dangerous. So, yeah, and then we have the obvious things that are not illegal, like alcohol, which can quickly turn into a problem, right? If it's not used appropriately. And we can also have the same issue with prescription drugs, sleep medication, anxiety medication. It can also become problematic if it's overused or used in the wrong way. So that's basically what I wanted to say about substances, but I wanted to touch briefly on addiction. If you are around someone and you may think they have a problem, here are a couple of things you can look for. If you think that they might be hiding or lying about using, if you think that they look like they're guilty when you talk to them or they look like they're ashamed, if you've seen someone who's trying to quit and they can't, and if you see that, let's say they're spending a lot of money or just doing some really irresponsible things that are out of character, it could be a substance use problem. So what can you do about it? I wouldn't talk so much about the spiritual because some other panelists touched on that already. But practically, you need to reach out to somebody. You can talk to a doctor. You can go to Alcoholics Anonymous. You could look up, there's lots of resources online that you can look up anonymously. But you can certainly reach out to Fraser Health. They actually just launched 24/7, well, I shouldn't say 24/7, a 365 days a year access line for mental health and substance use. And you can call with like any query, any question about treatment or anything like that. I think they will be open 8:30 a.m. to 8:30 p.m. And I also just wanted to say that for those of us who may be brave enough and we've seen someone who has overdosed and we think it might be an opioid, the pharmacies do give out free naloxone kits, and those are kits that reverse an opioid overdose. And they will give you the training to use it, and it's free. It looks like this. It's kind of small. Sorry. I know I should have put it up there, but it looks like that. And it's free from any pharmacy in the Lower Mainland. Okay, that's all I have to say. Thank you.
Thank you. Thank you so much to the panelists. Lots of wealth of knowledge. We appreciate you. So I'm just going to throw it to the audience now. If you have any questions related to reproductive health, physical health, mental, emotional, social. Yes, I think that's the themes we have here. So anyone have a question for our panelists? Oh, there's a question. Okay, we need a mic.
Yeah.
Because,
Can you get a mic for the audience? For the audience.
Thank you so much, everyone. We're very insightful listening to everybody. My question is different approaches. So my first question is actually to physiotherapists. Let me start my first question is actually to the physiotherapists. I haven't really been, I'm kind of weight obsessed, right? So at the point where I decided that, you know what, I'm whatever weight and I'm happy about it, started having serious knee issues, which I figured due to my weight, no longer supporting the new body size. And I started working on it, started going to the gym, just to keep fit. And what scared me was the point at which somebody, well, a few years younger than me, no children, but she was at the same similar body size, and she told me that she had diagnosed with osteoporosis. Like basically her kneecaps were diminishing. And that brought a real fear for me home, because one of the things that I learned during my first pregnancy was that if you have any deficiency while pregnancy, the baby is going to go into your bones, your teeth, and just take all of those nutrients. And I'm scared because this person has never had a child, and this is her situation. This is me with two, with anemia, and this is my situation. So what am I going to do? I can't even extend myself.